Well, good wet Monday to you, and welcome to our Monday morning live edition.
It is wet.
Very wet.
Healthy Living South Mississippi. Live healthy, be healthy with Drs. Jim and Janine Fox of Doctors Nutrition. We're just getting the remnants of Patricia coming through here. And
I wouldn't want to get the whole thing.
Oh, yesterday was bad.
Yeah.
Bad enough. It rained. I mean, as much as we badly needed the rain.
We did need the rain.
Yes.
The drought has
Everything was
broke.
dry, yes.
Yeah, and I kept thinking, well, maybe I won't have to mow my grass again this year. Well, that went out the
not
window.
sure.
So that's not going to
It'll
happen.
grow a foot in the next week.
This is true. This is true. But anyway, our phone lines 896-0713, 800-349-0713. Mr. Lee is on the phone. He's answering the phones today. So you have a question for the doctors, call in and ask. You can talk to them yourself, or you can, if you don't want to be on the air, you can pass the question along to Lee, and he'll be glad to pass it along to us. Anyway, this morning we're talking about something that millions of people suffer from.
Millions.
You know, if you have joint swelling, joint pain, swelling, stiffness, mainly in your arms or your body, whatever.
It could be any joint. Yeah.
Any
Arthritis could
if
take
there's a joint,
yeah, arthritis takes so many forms. You know, it's like I say, any joint.
Mm-hmm.
You know, it's susceptible to it.
Yeah,
seriously.
you can have it in your spine. You can have it in your. I mean, a common place is the hands.
Right.
You can have it in your feet.
And doing
knees.
something
You can have it in your
repetitively,
knees.
all the time, working
Yes.
with your hands or whatever is going to cause that, because it's going to cause stiffness in your hands.
Yeah.
I mean, my wife, she crochets a lot. She does a lot of custom crochet work. So just sitting there all the time doing that, and about once every couple of days, I have to massage her
wrists.
arms and
Right.
everything, her arm real good, because it does get stiff. But rheumatoid arthritis, once it gets into an advanced situation, I mean, it could really cause some severe joint damage.
Well, rheumatoid's a little different because it's an autoimmune disease. So
Right.
it's not just your regular osteoarthritis. Now, almost everyone as they age gets a little bit of osteoarthritis, which is degeneration.
They used to call it everybody's disease.
Yeah, they did, because, I mean, regular
Everybody gonna get it.
osteoarthritis is so common. Now, rheumatoid is still common. I mean, we're seeing more and more people with it, but it is an autoimmune disease, so it's a little bit different. And it can happen, you can even have juvenile RA, which happens at a very young age. So arthritis, there's many other forms as well. Today we're going to talk more about the rheumatoid and osteo, because we're going to talk about one of our specific products that we use for that. But you also have, I mean, when you talk about arthritis, you have psoriatic arthritis, you have gout, you have, I mean, there's so many different forms.
It takes on, you can even have an injury or an infection that can set
Right.
up an arthritic joint.
Yeah.
If you have an infection or if you have a bad injury to a joint, typically it's going to become arthritic as time goes on. So, there's so many forms of it, and, if you live long enough, like I say, you're going to have one of them.
So one of those is going to get you at some
Yes.
point.
Gonna get
Yes.
you. All right, yeah.
So again, our phone lines are 896-0713, 800-349-0713. If you're having problems with arthritis in any way, shape, or form, please call in, and the doctors will be glad to field your question and talk to you about it. Because, as you said, you have something that basically is done very well for people that are dealing with arthritis.
Yeah, and actually we use everybody's heard about glucosamines, they've taken the glucosamines and so on. We have a product, and we've used it,
For
years.
years.
I have been involved with it for about 30 years or better. And it's called Perna, and P-E-R-N-A, Perna, and it's actually Perna cataliculus. It's a green-lipped mussel, and it only comes from New Zealand. That's where it originates from. And the research on it goes back into the 60s and early 70s when they started using it.
And initially, it was probably used more in veterinarian medicine.
It actually started
really
out in veterinary medicine,
Yeah.
right? It really did. The first time I ever saw it was in veterinary medicine. A friend
There's
who
probably
was
joints in horses and things
Yeah.
like that.
The
The dogs
one
and-
Yeah.
I saw it in a dog, and a friend who was a vet, and he had a dog that had some real bad hip dysplasia, big dog, Labrador Retriever, and within 2 weeks, I mean, this dog was up and moving around and doing fine, and it was really kind of remarkable. And that was probably back in early 80s. And I said, okay, can people take this? And he said, well, it's a shellfish. It's like an oyster type thing. And it really is pretty remarkable in the contents of what it's got in it.
Speaking of, you asked if anybody could take it, and we'll just say at the beginning,
if
the
you
few
got a
people,
shellfish
if you have a
allergy.
shellfish
That was
allergy,
my next
you cannot
question.
take it.
That was my next question. I was going to say, what if you have a shellfish allergy?
That's the
Yes.
downside.
And we do say on our bottle real big,
If you have
contains shellfish, so you
Yeah,
want to
if
make
you
sure.
have a shellfish allergy,
then
no, probably not.
unfortunately, you can't.
Yeah.
People come in and they want to know what we have for arthritis, and I'll say, oh, the best thing for it is Perna Max, which is
Right.
the name of our product, and they'll be like,
Yeah.
And the first thing I ask them is, do you have a shellfish allergy? And they're always, so many people say yes. I'm like, too bad, you can't take that one.
No. Does Perna work for gout?
No.
No.
Now, that was another thing that we were going to say. You don't want to take it because, of course, shellfish a lot of times flares up gout. So we don't use it usually in gout. We have something called uric acid formula that works really good for gout, and changing the diet.
And the diet's a biggie. I mean, you can kind of manage
really
it with diet. I mean, unfortunately, that's what you have to do with gout. But you know, when you get into your osteoarthritis and even the rheumatoid, I mean, they've done quite a bit of research on the Perna and rheumatoid. And it's got so many beneficial aspects when it starts to, it down modulates or down regulates, if you will, the immune system, or the immune response. So you don't get that autoimmune overreaction with, like you would with a lot of things. So when it's got for the rheumatoid arthritis, I mean, that's great.
Yeah, and even there was a study that, of course, they used with rats. It's been years ago when they did this study, but they took 2 groups of rats and they made them prone to RA. I mean, somehow they make them prone to getting rheumatoid arthritis. And they gave them, one group got Perna, the other group got nothing, in their diet added. And at the end of the study, they showed that the Perna group, only 18% ended up getting rheumatoid arthritis, to where 66% of the other rats that didn't get the Perna got rheumatoid arthritis.
They developed
so they're even showing in some of the research it can prevent in people that are prone to it, which is really interesting.
Very
Claudia is on the phone with a question regarding arthritis. Good morning, Claudia.
Good morning.
Good morning.
Good morning. I have arthritis in my knees really bad, and I was wondering what I should take for it.
This Perna would be exactly what we would start you on. As long as you don't have a shellfish allergy, that would be the first thing we would put you on.
Because the Perna has a lot of good research too, and even helping maintain the joint space in the knees. Now, the only time it's not is when you have bone on bone. They have showed that in stage 4 or grade 4 osteo, it is not very effective, because that's when it's bone on bone, and I'm not sure how bad yours is. Do you know?
I don't. I just have been having problems with it the last couple of years.
Okay, well, you're probably still in the first
still
couple
early
stages, and that's the stages that's been shown the most beneficial.
Right.
And there's a lot of other anti-inflammatory products you can take, even fish oil, but the Perna actually contains some omega-3s, and that's one of the benefits of the Perna.
It really does. It's actually got those EPA and so on, the omega-3s that down-regulate the inflammatory response. In this particular product, Claudia, we added to it some boswellia, which is another plant extract that we know that is an anti-inflammatory. So we've got a lot of anti-inflammatory properties with this stuff.
Really, with knees and hands, I mean, I see probably Perna Max work best for knees and hands. When people come in and tell me they have knee problems and hand problems, that's definitely the first thing we use.
I better pick up some for my wife. Thank you very much for the call, Claudia. 896-0713, 800-349-0713 are our phone lines. If you have a question regarding this morning's subject of arthritis or anything in particular that you'd like to ask the doctors, please feel free to call in. We'll be back with our second segment on this morning's Healthy Living, Live Healthy, Be Healthy segment. And welcome back to our Monday morning live edition of Healthy Living South Mississippi, Live Healthy, Be Healthy, with Doctors Nutrition's Doctors Jim and Janine Fox, located on Cowan Road, just south of Pass Road in Gulfport. We're talking about arthritis this morning, different forms, things that you can do if you are suffering from it, are dealing with it. Whatever stages. You can call in with your questions at 896-0713 or 800-349-0713. What's the difference in, let's say, glucosamine products and the Perna?
Well, glucosamine, typically when you buy your glucosamines, you're buying either a plain glucosamine, which is glucosamine sulfates normally, or a glucosamine chondroitin combo. And you need those things. Those are part of it. Now, the thing of it is there's 9 different glucosamines in Perna, and there's 5 specific glucosamines that our joints have to have for that proper function and so on, and repair, etc. So Perna is the only one that actually covers all 5 of those particular glucosamines that we need in our body for healing.
And then it also has not just the glucosamines in Perna, but it contains 2 different kinds of chondroitin.
Right.
It contains hyaluronic acid. It contains your omega-3s. So when you start looking at it, there's so many different components in Perna that is not in glucosamine. Now, in our Perna Max, we add glucosamine sulfate, which is your main glucosamine, to it.
It is your main, right.
So, and then MSM, which is also known to help with arthritis. MSM is a source of organic sulfur.
And we put Boswellia in there for a
And
little
Boswellia.
bit of added anti-inflammatory effect too.
And Boswellia is frankincense. A lot of people have heard more of frankincense, and but that is what Boswellia
Well, usually
is.
heard that frankincense and myrrh.
Right.
Actually, yeah.
Great anti-inflammatory.
Yeah.
So these are of course, some different things that you can do. Are there any kind of maybe exercises or something we can do to go along with that? I mean, they always tell you, maybe to you can stretch.
Keeping your motion in the joints. I mean,
motion is the big thing. Right.
And more motion you have in a joint, the better off it is.
Drink a lot of water.
Because
stay well hydrated, obviously.
You
and
got to
you
keep
do,
your bones and your
because
joints hydrated.
moving helps that synovial fluid. There's fluid in every joint, and pumping it does help.
And
so,
if it's hurting real bad, if like for instance your hands,
right,
fill a sink full of real nice warm water, and then exercise the hands just in that warm water. And then they do some things like paraffin bath and things like that for it too in some of the offices. But
Epsom
again,
salts.
Yeah,
Epsom salts helps with getting the magnesium, and magnesium definitely helps with more of the muscles. I always say it helps more of the muscles than the joints, but it definitely helps.
But any movement, I mean, that's actually how that synovial fluid regenerates itself is through movement. So if if anybody's ever broken an arm or something, had it immobilized for say 6 weeks,
right,
it's really stiff when it comes out of the cast, and then you have to work it and work and work to get that joint motion back. Same thing with, with you got an arthritic joint, even if it's a knee, like Claudia was talking about her knees. Now you don't want to load them. I mean, you don't want to put a heavy load on it.
Right.
But just moving that joint, with a non-load bearing kind of movement.
That's why water exercise.
Water's so great.
If somebody has advanced arthritis, doing some of the water aerobics and stuff really helps because it takes a lot of the pressure off the joints and a lot of the weight off the joints. Because you don't want to. Unfortunately, one of the worst things you can do is pound the joint.
Like
you want
running.
it movement, but running. We have a lot of runners that come in, and they have, of course, knee problems. And I always tell them the worst thing you can do is keep pounding on them. I mean, that's what's caused it in the first place. A lot of times, arthritis gets in joints that were injured when you were younger. So you see a lot of athletes.
That's that injury
later on in life.
Right. And I've heard that the older that we get, that it is better for us and our joints if we. If you just do like a brisk walk, and not like you said, pound it.
And if you want to run in a swimming pool, because honestly, it'll take the weight off. It's harder to do than it sounds, though. I was going to say it really is.
Try
hard.
that one, folks.
Yeah, it is hard.
Yeah.
And there's a lot of the community centers that have pools.
Yeah, right. Exactly.
Have
water aerobics, things
water
like
aerobics.
that.
I know Donnell Schneider Community Center right down the street here.
Yes.
Because
a lot of people go to that one.
The natatorium in Biloxi.
Right. All those.
There's a lot of
pretty
them.
much anywhere you go, around wherever the listening audience. There's somewhere around that's going to have some sort of water aerobics or something. And it's great to do, especially if you've got those. Especially like the knees, because you can do it and it helps to take the load off that knee, keep it moving. And that's the best rehabilitation for it, really.
Another one of the interesting things about the Perna that is a little bit different than the glucosamine as well, we didn't mention it before, is the repairing of the cartilage. They've always said that probably cartilage can't be repaired, but in some of the research done on Perna, it says that it does. And so with all your glucosamines in Perna, another thing that it does different than just your anti-inflammatories, taking ibuprofen or taking something for inflammation, is that just helps the inflammation. These products, Perna and glucosamine, tend to stop further degeneration, which is the key.
That's one of the keys.
Which is why you want to do it early. You don't want to wait until you can't walk. You don't want to wait until it's bone on bone, and then it really is too late. At that point, really joint replacements is the only option at that point. So you don't want to wait until it gets to that. And I don't think anybody wants to.
No,
you're
I don't think so.
You're looking
well,
like.
no, because it makes me think. I was talking to one of my fellow employees here this morning, and I asked him, I said, "Are you limping?" He says, "No, he just has a." He's probably going to end up needing knee surgery here soon because his knees, that joint thing going on.
When it gets to a point to where it's bone on bone, honestly, what anybody has probably isn't enough.
Not going to help it.
Unfortunately, but like I said, start early. You don't wait until those joints get to that point. And almost everybody's going to have some osteo. And like I said, we talked about rheumatoid. If you have rheumatoid, it's been shown to help that too, which plain glucosamine has not. But Perna, because of the way it downregulates the immune system, it does.
And I was, reading some of the symptoms on rheumatoid arthritis. Weakness, flu-like symptoms, including low-grade fever, worst joint stiffness after you sleep.
Yes.
Or, you know, after you've been sitting down for a long time.
Right.
If you go to get up and it's like, oh, give me a minute.
Yeah. And sometimes we have people come in and not sure if they have osteo or rheumatoid, but you can do some blood testing to see if it's rheumatoid.
Okay.
And we do that blood testing also.
Because I'm sure there's a lack of certain things in your body.
No, there's more of things that shouldn't be there, like an RA factor.
Really?
Yes. There's not a lack of things. I mean, there's no doubt nutritional deficiencies play a role in getting arthritises, but when you start checking for rheumatoid arthritis, it's more of containing RA factors.
There's too much stuff in there.
Right.
Too much of the wrong stuff.
Right, that shouldn't be.
Okay.
So you can check, kind of a rule of thumb, in your hands, if it's the distal joint, the very distal,
ends.
right here,
Okay.
it tends to be this joint and this joint tends to, not always, be osteo. If it's in the hand joint, and this, it tends to be RA. So, you know, like I said, you can't ever make a blanket
your
statement.
arm?
That can be
That's pretty
either.
much-
That can be either.
Yeah.
But so many
Okay.
people come in where their hands start first. And I always say if it starts in that hand, you definitely want to be checked for rheumatoid. So when it starts in the actual hand itself and not the fingers.
Right.
There you go.
Yep.
Okay.
Exactly.
896-0713, 800-349-0713. Our phone lines are open to you if you'd like to call in with a question regarding today's subject of arthritis or anything else in our final segment coming up here in just a moment. Those are our phone lines. It's our Monday morning live edition of Healthy Living South Mississippi. Live healthy, be healthy. And welcome back to our final segment this morning of our Monday morning live edition of Healthy Living South Mississippi. Live healthy, be healthy. With Dr. Jim and Janine Fox of Doctors Nutrition on Callan Road in Gulfport, just south of Pass Road. We got to mention this. New lights.
Yeah.
You might notice
I
we
don't
got
know
new
if anybody
lights.
can
I mean,
tell
just
or
kind
not,
of the
yeah.
colors were really popping. So we got new lights up there that
Yeah.
really look good.
LED, very
LED.
energy efficient.
Yeah, energy efficient. They're not hot because
No.
normally you sit up
Yep.
here and it's like we're just whoosh, wanting to sweat. Of course,
Yeah.
me more so because there's nothing up there to soak it up. Anyway, Ashton is on the phone with a question about rheumatoid arthritis. Go ahead, Ashton. Good morning.
Good morning.
Morning.
I've had arthritis for a long time, and I have trouble with fluid in the lining of the lung. They keep going in and tapping the fluid out, and I hadn't done that in a long time. I have trouble with the left knee and the right hip,
Okay.
but I've had rheumatoid for over 10 years.
Is it rheumatoid
Yeah.
arthritis?
Yes.
That's one reason why it's probably getting in other parts of the body, because rheumatoid is not just in the joints, and which is what a lot of people maybe not know. There are some other things that you can do for that, because rheumatoid, there's so many things that they're researching right now in medicine, because that they think it could be fungal problems in the lungs,
Could be.
and even viruses or bacteria that's causing the rheumatoid to begin with. And so we do use a product called Olivir to actually help part the immune system part as well. And the Pertamax would be good for you as well for the joints. But there's other things that you can do when it's rheumatoid to support the immune system and to help with things that could be the cause, which even in medicine right now, there is research coming out of Colorado showing that they think that it could even be a type of a fungus that's in the lungs.
Yeah, Colorado State's doing some
Yep.
work on
It's
that.
brand
They've
new
actually-
research came out this year.
They've actually published on the fact that something has to trigger, the autoimmune response, and it could vary. And what they're seeing in the tissues that they were sampling is actually the various fungal stuff. So strong possibilities, something like an antifungal, antiviral, which the olive leaf
And
extract
doing some of your
is.
probiotics as well.
Right.
Yeah, I was thinking about probiotics.
Yeah, oh, yeah.
because those
Yep.
things are great.
Right.
Huge.
Okay, Don is on the phone with us now. Good morning, Don.
Good morning.
Morning.
I'd like to know if you could tell me. My wife has gone through right at 6 to 7 kyphoplasties. And then every time she feels good, she turns the wrong way or bends, and pop, here comes another one.
Mm-hmm.
What do you suggest she could take to really help strengthen her bones and maybe get some mass back?
Well, again, back to something like the Perna, to help support the joints, which it has some of your hyaluronic acid. Even some pretty big doses of vitamin C, which helps stimulate that hyaluronic acid. And then, if looking at the bone itself, make sure the vitamin D is in good shape. And of course, we use the A, D, and K all
K2.
together. ADK2 is what it's called.
And also, she needs to be doing some exercise to strengthen the area.
Right.
Exercise is always going to help with strengthening, because once you've had an injury, you're always going to be prone to it, unfortunately.
Right.
I don't know, yeah, once there's an area injured, you have to do more to make it strong than you might have had to before.
And it's supporting, the around the joint. In other words, the musculature and so on around a joint is what you have to really support.
Okay. Eileen on the phone with a question. Good morning, Eileen.
Good morning.
Good morning.
What can we do for you?
I have a sister who has had a terrible fracture of wrist.
Okay.
And she had nerve damage, and her therapy is her arthritis is compounding the therapy because it hurts. Her knuckles are bad and hands are bad. And is there anything that can help? We don't know if she has permanent nerve damage in her fingers yet. And we just don't know if there's anything. I didn't get the name of the product you were talking about earlier.
Okay, it's Pernamax.
We've got a graphic on that.
And we do, because it's going to be our special this week. So Pernamax is the special, and Pernamax is not even really that expensive. It's $31.95 normally without the discount, and it's a month's supply. So that's something that most people can't afford to do, and it's something that really does help. And it's hard to say with fractures, it does make it worse, because you've broke the bone, and you've probably damaged some of the ligaments and tendons and connective tissue. And if you have osteoarthritis to begin with, it's going to make it worse. But if she does the Pernamax, that may help her to where she can do the exercises better to rehab the other areas.
Help her rehab it better, right.
And we even have something called Innocin that is used for nerve pain, and it does seem to help. So, that might be some things that she can do that would help her through her rehab, but rehab is going to be essential.
No doubt about it.
Yep.
All right.
Thanks, Eileen.
Thank you, Eileen, for your call. 896-0713, 800-349-0713. We have just a few minutes left in our final segment here, talking about arthritis. So if you have something else you want to ask, be sure that you can welcome to call in. Next week's, which will be the first Monday of the month, we'll do our open line Monday.
Right, which we do every first Monday of the month.
Yes, and so you can call in and ask questions about pretty much anything.
Yep.
That anything, as my dad used to say, anything that ails you.
That's right. Exactly.
Anything that ails you. So the Pernamax, we talked about doing that as far as got a couple of minutes left. So and again. A lot of fluid, a lot of water.
Oh yeah, water. Now water does lubricate the joints.
Yes.
You bring up a point. Dehydration will make arthritis so much worse. So I do tell people, make sure they get plenty of water.
And somebody say, "Well, drink plenty of fluids." Soft drinks aren't fluids.
No.
Well, they are.
They are. But I mean,
the sugar, like we talk about every week,
causes inflammation.
Causes inflammation and is damaging to the joint. So you don't want sugar drinks. You definitely need water.
And try to back away from the sweet tea. I mean, we love our sweet tea down here.
Unsweet's okay. So you can do unsweet tea.
And if you have to put some kind of sweetener in it, we've talked about that before.
Maybe stevia, monk fruit, xylitol, things like that.
Those are some good things. So, a lot of it is just, really common sense as to what to do to, stretch them, exercise a little bit.
Keep motion.
Keep motion, and just don't sit there, because the more you sit there, the more sedentary you are, the worse it's going to be.
That's
true. Move it or lose it. That's what it boils down to.
This is true.
Yes.
That works out. That works out too. So, but any closing thoughts?
Just, if you've got these problems, do some of the little tidbits that we talked about today. Maybe take some Perna, prevent some of those problems.
Yeah, call us if you have any specific questions about yourself.
897-0070. Remember, the doctors are there Monday through Thursday between 8 and 5. The store is open Monday through Friday between 10 and 5. Got you there early. Between 10 and 5. And then on Saturday, 11 to 2, but the doctors are only there Monday through Thursday. So if you need to stop by, but they're located on Callan-Lorraine Road in Gulfport, just south of Pass Road and across from the old Kmart building. So anyway, don't forget, next week is open line. Have a good day. Please drive carefully. Remember, don't run driving through that standing water.
Right.